Good afternoon. County Executive Rich Fitzgerald here, taking off my mask. And the reason I'm doing that for the first time in a year, when we started wearing masks, is there's 7 of us in this room, and every one of us have been vaccinated for more than 2 weeks. And that's what the vaccine is doing for us, among other things. Obviously, we're seeing hospitalization rates and death rates come down as things start to open up safely in Allegheny County, in Pennsylvania, and across the country. So I just give you a couple brief things that, I've had a couple of meetings this week, and it was interesting. The one group of people that came into the conference room, everybody had been vaccinated in over a month, their second shot. We could all take our masks off and have, the normal meeting we had prior to this pandemic. But I've also had meetings where people haven't been vaccinated, and we all had to keep our masks on. We all know that Governor Wolf and the state came out with their recommendations yesterday that by the end of May, we are going to go back to eliminating the percentages of folks that can go to a restaurant, the percentage of folks that can go to a movie or a ball game or any other type of event. And that's really good news as we start to get back to normal. Everybody has been eligible for the last 3 weeks to get a vaccine. So we still encourage you to do that. We're still around 68% of the adult population in Allegheny County with at least 1 shot in arm. What's that mean? The 32% haven't. And we need to get those other 32% safe and healthy and for all of us, including obviously themselves. So we really appreciate that. But they're plentiful right now. There's plenty of places around the county where you can get them, and we'll take them to certain communities to try to help out. So anyway, it is good news as we continue to move along. Dr. Bogan's going to give her weekly report and let us know where we are and where we can continue to go. Dr. Bogan?
Thank you, County Executive. Good afternoon. This week, I'm going to do something a little different. After I give you the numbers, I'm going to discuss vaccine hesitancy and why that phrase should be reconsidered. But first, the numbers. It was an up and down week with a daily case count as high as 366 and as low as 158. Despite those fluctuations, the average daily case count dropped slightly to 240 cases a day over the past 7 days. Positivity rate and hospitalizations continued to decrease slowly. Sadly, we continue to report COVID-related deaths, including 75 in the month of April. 12 of these were in adults younger than 60. Although cases are dropping, they aren't dropping as quickly as I would like. I would like to see cases drop significantly as we approach the end of the month when mitigation orders, except for masking, will be lifted. With this impending change, the more people who get vaccinated, the safer we will all be. So, where are we with county vaccination efforts? Great news, 94% of people 65 and older received at least 1 dose of vaccine. Among those 50 to 64, 68% are at least partially vaccinated. And for those 39 to 49, the rate is 60%, and for those 20 to 35, 49%. As for eligible teenagers, meaning those 16 to 19, 25% are at least partially vaccinated. These vaccination rates are encouraging, especially that our most vulnerable age group, those 65 and older, are vaccinated at such a high rate. But the work is not done, and I believe we can and must do better. Vaccines have been available to everyone 16 and older for a couple of weeks now, so we have to ask ourselves, what's keeping more people from getting vaccinated? One contributing factor is what has been called vaccine hesitancy. I'm going to address that today, and I'm going to do so by presenting and then busting several myths surrounding the COVID-19 vaccines. Some myths are based on plausible concerns, while others appear to have been conjured to deceive. For instance, consider this one. The vaccines include microchips to track you. This, of course, is a myth. There are no microchips or other electronic devices small enough to fit inside the needles used to inject vaccines. The vaccine's purpose is to protect you from a deadly virus, period. They are not being used for tracking. Myth. The vaccines contain meat products, in particular gelatin. This is important because if it were true, it would carry serious implications for people like me, vegetarians, and for people of certain religious faiths. However, I can verify that none of the approved vaccines, Pfizer, Moderna, or Janssen, contain gelatin or any other animal products. Myth. There's no point to getting vaccinated because you still have to wear a mask. Truth. Vaccines protect you from getting seriously ill. Masks are still needed in certain settings to protect you and to protect those around you who have not been or cannot be vaccinated. And there are some people who cannot be vaccinated because of age, health conditions, or other reasons. Myth. Vaccines cause infertility. Truth. No evidence supports this. The truth is that COVID-19 vaccines do not affect the fertility of women who are seeking to become pregnant. And while I'm on the topic of pregnancy, tens of thousands of pregnant women have been safely vaccinated, including some of our staff. Again, the vaccine is far safer than getting COVID while pregnant. Myth. The vaccine costs money. Truth. The vaccine is free to everyone. The cost is covered by the federal government. However, vaccine providers may charge an administration fee, but they cannot charge for the vaccine itself. The Allegheny County Health Department does not charge an administration fee. Vaccines are 100% free at all of our clinics. Myth. The vaccines don't work against variants. Truth. Actually, research shows that the US vaccines are highly effective against variants, which is very encouraging. Myth. The vaccines contain aborted fetal cells. Truth. None of the COVID-19 vaccines contain whole or partial human cells or bits of tissue. It's true that some of the COVID-19 vaccines were produced through research that involved cell lines from tissue obtained legally after an elective abortion nearly 50 years ago. Those cells were turned into a cell line, a research tool that scientists can use to study how viruses cause infection. But other COVID vaccines did not use the cell line in their research process. Myth. If you had COVID-19, you don't need a vaccine. The truth. Even if you've had COVID, getting the vaccine is beneficial by bolstering your immune response to the virus. The immune response from the vaccine is stronger and longer lasting than natural infection. Myth. The mRNA vaccines will change my DNA. Truth. They do not change your DNA. The messenger RNA vaccines, Pfizer and Moderna, do not enter the nucleus of the cell where DNA is located, and the mRNA lasts just a couple of days and then it's gone. Myth. Young people don't need to get vaccinated. Truth. Everyone eligible should get vaccinated. It is true that young, healthy children and adults generally are not severely sickened by COVID-19, but some develop long hauler syndrome, and they certainly contribute to the virus's spread. Again, everyone should get vaccinated, not only for yourself, but for your parents and your grandparents and others with underlying conditions. Finally, and this is possibly the most important myth to dispel, the vaccines were rushed and therefore were developed too quickly for anyone to be certain they are safe. Truth. The science is solid. These vaccines are rooted in well-established technologies used to develop other vaccines. They underwent extensive testing in tens of thousands of people, including the county executive and me. They have been now given to millions across the country. They are safe and certainly far safer than getting COVID-19, which I will remind you has contributed to the death of nearly 2,000 Allegheny County residents and 75 people in April alone. So remember, the vaccines underwent rigorous testing. I got vaccinated, and I urge all of my loved ones to do the same because I know they're safe. So there you have it. There is a lot of false information about vaccines that may be impacting your vaccine decision. If you or anyone you know have lingering questions or concerns about the vaccine or the virus, please talk to your doctor or visit alleghenycounty.us/coronavirus. There you'll find all the resources you need. The vaccine, if enough of us get it, will allow us all to return to normalcy, to hugging our loved ones, to dinner parties with friends, to dining in restaurants without fear, to once again enjoying large outdoor gatherings to celebrate the 4th of July, Light Up Night, New Year's Eve, and who knows, maybe another Stanley Cup Championship parade. I mean, we are good at parades. But to get there, we must erase vaccine hesitancy and replace it with vaccine confidence. I am confident. I hope you are too. So go ahead, register for a vaccine, and do so with vaccine confidence. Thank you for your time. Be safe and be kind.
The first question that we have today is from the Pittsburgh Business Times. What do you think about the plans by the governor and how Allegheny County will be able to handle outbreaks of COVID-19 in the future now that many of the mitigation measures will be lifted at the end of the month?
So we will continue our work at the Allegheny County Health Department just as we have done. We will continue to call cases and do case investigation. We will continue to do contact tracing. We will continue to offer testing to make sure that anyone who's symptomatic gets tested, and we'll continue to offer vaccines to people and do our work. So that's how the County Health Department will continue their work. I don't know if the County Executive wants to comment about the county in general.
Yeah, I want to thank the governor and the State Department of Health for moving forward and making this announcement, because I think, number one, the fact that so many folks are now getting the vaccine and becoming safe. Families are safe, and the fact is, once we hit June 1st or May 31st, that things are going to open up again. You can go to a pirate game, you can go to a show, you can go to a community festival. We're obviously hopeful that the mask mandate will lift as we get over 70% that we're talking about right now. But the key is really going to be those last 30% of folks to go out and get vaccinated. I appreciate the fact that Dr. Bogan dispelling all of those myths that have been spread falsely on certain channels, et cetera, that we got to get vaccinated. That's the way to do it. She's doing it. I did it. I encouraged my family members to do it, my kids, my parents, everybody in my loved ones. I wouldn't do that if that wasn't safe. And we're seeing great results across the country as more and more people get vaccinated and our hospitalization and death rates continue to drop.
This next question is from KDKA. What will May 31st look like in Allegheny County? Do you have any advice to business owners or the public on how to get out safely? And for people that haven't been out and about for a year, what's your advice to them on feeling safe as we return to normal?
Well, once they get vaccinated, they're going to be safe. So that is the key. Businesses, and I would obviously encourage the businesses and their employees to all get vaccinated. That would make the public safe, feel safe that where they go and patronize a retail establishment, a restaurant, an art gallery, a show, a museum, whatever it might be, that if all the folks in there that you come in contact with have been vaccinated and you've been vaccinated, you're going to be good. The science is so clear on this. This May 31st will look a lot different than last May 31st. I know people just naturally are going to be reluctant. I can tell you, even as we're all sitting in a room with all of our masks on, and people get sometimes just because it's been natural for the last year to keep the mask on, but again, as everybody gets vaccinated, we can get back to normal. And I think businesses, offices, and all the things I talked about, and family gatherings can get back to normal.
This next question is from WPXI. Last week, the county executive said we could be done with masks by June if we all continue to do what's right and cases go down. The threshold cited by the governor, it doesn't have to do with cases, but instead percentage of adults vaccinated. Does that change your thinking on the timeline at all, or are you still confident we could get there by summer? I
am, and the fact that we're at 68%, at least one shot in arm for all adults, that means 3 to 4 weeks when people get that second shot. They're going to be there, plus all the folks that are going to get the shots in the next few days. So we should be well over that 70% by June 1st. But to be at 71 or 72%, while the mandate will lift, that still leaves 28, 29% of folks vulnerable. And I saw the CDC regulations or CDC initiative that came out today, worrying that we're still going to have significant death and hospitalizations among those 30% of people or 25% of people who do not get vaccinated. They are leaving themselves and their families vulnerable if they don't get vaccinated.
This next question is a similar one, both from Pittsburgh Business Times and WPXI. How long do you think the masking measure should be in place?
Again, I think when we hit that 70% threshold in the next few weeks, that could be the place to go. But here's the problem. If you aren't vaccinated, you're still going to need to wear your mask. And that will be the case for ad infinitum until people get vaccinated. So that's going to be problematic for that small percentage of the population that leaves themselves at risk.
And this final question is for both of you from both Post-Gazette and KDK, similar questions. The governor's announcement yesterday said that the updates won't prevent municipalities and school districts from continuing and implementing stricter mitigation efforts. That obviously applies to the health department as well. Philadelphia has indicated that they're going to ease restrictions when their local leaders say it's time. What is Allegheny County looking at as far as easing restrictions or waiting longer than what the governor's timeline is?
Well, I'll let Dr. Bogan jump up on that, but then you go.
So we have followed the state guidance for the last many months. We don't have our own mitigation orders in place. We have gone with the state. So when the states are lifted, so are ours. And that's a little different than Philadelphia. As I've said from the very beginning of the pandemic, my decision making has been driven by the data in front of us and the cases and what's happening. And I will continue, and our team here will continue to monitor data and our local data and make decisions for our community based on the data. But as of now, we will be in lockstep with the state because that's what we've been doing for the last many months.
And that was the final question, if there's any closing remarks.
First of all, thank you, Dr. Bogan and the Health Department for the great work you've been doing literally throughout. And I think most of us in Allegheny County have followed the science and the recommendations that Dr. Bogan and her team and all of our medical experts throughout this region have done. We're so blessed that we have that expertise, people that have dedicated not only their careers but their lives to making us healthy. And obviously, during this pandemic, it's been needed more than ever. I go back to when I was a kid. Polio was certainly something that cast fear and worry in so many families, and there was no hesitancy in my mind, and I don't ever remember being hesitant, or any of my neighbors or family members, and people went and lined up. I remember lining up at the church that my parents took me to get that vaccine. And by and large, it was eliminated. It was gone because everybody got vaccinated. We can do the same with COVID. We can do the same with this pandemic if everybody gets vaccinated. Follow the science. We can eliminate this deadly disease that has cost so many families. As Dr. Bogan said, almost 2,000 lives in Allegheny County, over 26,000 lives in the Commonwealth of Pennsylvania, and almost 600,000 lives in the United States. So let's get vaccinated. Let's get back to normal. The path is very clear, and we're in a good place, and we need to just continue and get that last group of folks and their family members vaccinated. We'll see you next week.
Thank you for joining us. Our next regularly scheduled briefing is Wednesday, May 12th at 4 p.m.